My name is Patrick. I'm a student physical therapist. We're here today with Brennan, my community partner. We're going to be palpating some of the contractile tissue in the hip and pelvis region. Our first one on deck is the glute max. So go ahead and roll onto your belly for me, bro. Alright, you're going to roll your shirt up just a little bit. And your pants down just a little bit, that's okay. Just being able to press on the skin can help provide better feedback than pushing through the clothing at times. Alright, so our glute med, we're going to identify with our easiest bony structure, the iliac crest. We're going to start here in the abdomen region. Feel it right here. We're going to walk immediately. You can feel his PSIS right here. Pretty good. Pronounce. Feel okay? All right. And then we're going to go just a little bit laterally. And we got the superior region of the glute max. Go ahead. And then it does have a medial and inferior muscle belly as we get a little bit more laterally towards the gluteal tuberosity. And you can go ahead and have the patient contract the tissue to give positive feedback that you are on that muscle belly. So Brendan, I'm gonna have you lift your right leg up towards the ceiling, okay? And yeah, you can definitely feel that. All right, go ahead and let it down. All right, our next one, since he's on his belly, we're gonna go ahead and do the Piriformis while we're here. We'll do the glute med when he's on his side. So the Piriformis is a good landmark. Is kind of medially between the PSIS and the greater trochanter, which we're just gonna have him kind of rotate his leg a little bit to help us identify the greater trochanter right here. And then we identify the PSIS just briefly. So kind of a midline right here is gonna give us that Piriformis. And then, so we wanna try and appreciate the medial to lateral muscle belly orientation. The way we can kind of make sure that we are there is we can have the patient externally rotate, because that is what the Piriformis does when the hip is not in a flex position. So go ahead and bring your heel up here. And you're gonna bring your ankle towards me. And then try and push some resistance just so we can feel it. Hold on. Let me go ahead and get my elbow in here. Feel okay? Push your ankle towards my hand. Yep, kind of feeling it. I bet you're kind of liking that. All right, cool. Now, the next contractile tissue we're gonna palpate is the glute medius. So go ahead and lie on your left side for me, bro. All right, is that okay position for you? All right, we can keep that bottom leg bent, but we want to make sure that we're getting the glute med, which helps abduct the right lower extremity. So we want to make sure that we're in a true frontal plane here, so he's not compensating at all. But you got a nice stable position here at the bottom. And so for the glute med, we're gonna do the same thing. Kind of got the iliac crest here. And then we're gonna get along the iliac crest, and we can kind of move just medially and get an appreciation for that muscle belly. All right, and I'm gonna use my elbow. Go ahead and bring your leg to the ceiling. And I can feel that. Does that feel okay, Brendan?
Yeah.
All right. So those are the three contractile tissues, muscles that we identified via palpation, gaining positive feedback through muscular contractions of our patient Brennan today.